Hello, 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 everyone. Welcome to Talking with Dr. T tonight. I'm really excited about our show. If you can give me about 60 seconds and we will begin. Okay, everyone, welcome. It's 8:01 and we will begin. I just want to welcome everyone to Talking with Dr. T. I am stepping up my game with technology and we are streaming across 3 platforms tonight. So welcome everyone who's joining us on Facebook Live. Welcome everyone who's joining us on YouTube Live. And thank you everyone who's joining on LinkedIn. And we can credit this stepping up to technology to Dr. Irving Fryer. He's getting my system all set up piece by piece. So I am grateful to him. So I just want to thank everyone who has joined us this year for 2022 with our Talking with Dr. T episodes. I'm looking forward to our 2023 editions of our show. I have some great speakers lined up, so make sure if you are not following me on Facebook or Twitter or Instagram or LinkedIn, you follow me so that you can get updates on our speakers beginning in January, always the 3rd week of each month from 8 to 9 p.m. Eastern. So tonight, I'm very excited about our guest. My guest is Dr. Trahern LaFavor, and we originally met, I was calculating this today, 2013. Wow. We both were clinicians with the NFL, and we were working at the Rookie Symposium and the Rookie Success Program, and we were really about working with athletes on their mental health, preparing for life after sports, and being able to manage what it means to be a person, to be an athlete, to be a family member and a member on their team. So I'm really excited to have him tonight. And I am just going to read a snippet of his bio and welcome him to the show. So Dr. Trahern LaFavor, after years of striving towards his dream of playing in the NFL, Dr. LaFavor became a professional football player for the Chicago Bears. However, he was released after his first season when he had actually a 4-year contract. Relying on his faith to guide and support him, Dr. LaFavor returned to school and completed his master's degree and a Doctor of Philosophy degree in marriage and family therapy. Dr. LaFavor is also a licensed marriage and family therapist in Florida. So for those of you who are joining me in Florida, he is one of my go-to clinicians in Florida. He served for 5 years as the team clinician for the Miami Dolphins and using his experience with the NFL and in his new professional career. Dr. LaFavor has worked with NBA players and their transition processes. He currently supervises an award-winning multi-systemic therapy team in Sunrise, Florida, where he works with abused and neglected children at Jewish adoption and family care options. Dr. LaFavor is an ordained minister, works extensively in the faith-based community, and is happily married with a wife and wonderful sons, whom he is exceedingly proud. So tonight we will be discussing bridging the gap between faith, family, athletics, and mental health. And as part of our discussion, we will be focusing on his new book, Rebuilt: Life Before and After the NFL. Welcome, Dr. LaFavor.
Thank you so much for having me, Dr. T.
Yes, I am very excited. So why don't we, even though I just read your bio, could you kind of provide us a little bit more about your professional, athletic, and ministerial journey?
Okay, so it started for me at the University of Florida. I have a bachelor's in sociology, from the University of Florida, as well as a master's in marriage and family therapy from Nova Southeastern University. And I also completed my doctoral degree from Nova Southeastern University. I have a private practice where I currently see clients who are struggling emotionally, helping to repair marriages and relationships. And as you mentioned, I work with abused and neglected children. In our program, Multisystemic Therapy, it really goes into the home and empower parents with parenting skills to parent children who present with severe behavior challenges. As far as the athletics, I was privileged to come from a family. My mother, she played basketball in high school, and my siblings, my brother, he played sports as well, and my sister, she participated in track and field, and I'm the youngest of five. So that's how it all began as far as my professional and athletics began.
Can you tell us a little bit about your faith journey, your ministerial journey, because you come from a family where they started a church, and I just enjoyed reading about your father and your mother as well.
Yeah, I was privileged. I grew up in a home of faith. My parents are Christians, and they had a dream to build a church, and that dream started actually during the time of my birth. I mentioned it in the book. That was a unique time for my family. I was born, and then they decided to have this dream, and I was birthed into it. So my father, he's been pastoring 43 years, over 40 years, and they built the church in a local community here in South Florida. They started out in the frame house, and people laughed at them about, wanting to start a church, but they really believed in a vision to have a place where people can come and be empowered in their faith. And all of my siblings, we had to grow up, I mentioned being packed in the station wagon like sardines, in a can on the way to church. And, we all had to be a part of it. So I mentioned that in the book, and that's a key part of my journey because in the rebuild process that I mentioned in the book, it really took faith to help me rebuild my life when my dream was lost of playing in the NFL.
Thank you for sharing that. And it's interesting. I know when we were at the rookie symposiums, we would sit at the tables with the players and the team chaplains, and we all had kind of a common connection. But one thing I didn't know until reading your book is your basketball skills. And so I was like, oh, we never talked about that. And that, my sport of choice was basketball. So to kind of hear the coaches and the mentors that were involved in your life from a basketball perspective, it just kind of brought me back to some of my own experiences.
Awesome. Yes, it actually started out basketball for me in middle school, and that's how my journey began. And I was quite husky and large in size, but I didn't grow much after transitioning to high school. And then I discovered football. And then that's when the journey really began for me to explore football. And I learned that I also had that skill, and the agility I used in basketball, that was quite helpful as a linebacker and defensive lineman. So it was very helpful for me to actually play basketball and transition to football.
That's awesome. Now, I know this is not one of my questions that was on the sheet, but you had said that your coaches wanted you to play volleyball. What was the purpose and the benefits of playing volleyball?
At the time when my coach asked me to participate in volleyball, I'm like, well, what's the connection here? But for me, at least, being able to learn the importance of balance, and we were doing a lot of jumping and hitting the ball, and our team didn't win many games, but at least it got me introduced to teamwork and the importance of just being open to other sports and not really limiting myself. So that was a benefit as well.
It's interesting too. So when you think about your experience with volleyball, basketball, and football, one of the things that I always say in my role as a clinician in ministry is that everything I learn in life, I learned from basketball. What are your takeaways from those three sports that you utilize today as a clinician, as an ordained minister?
Good question. So at least for sports, when it comes to football, I would say determination. I think when I look at how football was instrumental in my life and the dedication and determination it took, and being able to navigate the challenges of life. So I would say football, that taught me the discipline. As far as basketball is concerned, for me, it was helpful in just helping me to, I would say, be a part of a small team with a common goal, because we were fortunate to win the championship when I was in middle school, as I think back, and then the intimacy of those, 12 players that were a part of that team was helpful. For volleyball, it was just really being open to something different, and being out of the box. And I think for me, I just learned that never be closed-minded to things, and I learned to just be open to other experiences. So that's what volleyball taught me.
I love it. I love it. So before we talk about bridging the gap between faith and mental health, let's talk a little bit about your book. I truly enjoyed reading your book.
Thank you so much.
I have little highlights and bookmarks in the pages, but your book, Rebuilt: Life Before and After the NFL. What prompted you to write this book?
My work with professional athletes after being released from the NFL. And when I became a licensed marriage and family therapist, I was working with NFL and some NBA clients. And just knowing that I had a previous sports background and was able to successfully transition out of it, that really inspired me. And currently, I actually do youth empowerment at my church. And I was privileged, as I talk about in the book, when I first returned home, I got involved in ministry. I was doing transportation with the elderly and just picking up those youth on Sunday morning and just seeing the faces of those, parents. It just brought me back to that. And I felt like I had a story that needed to be shared. And that really inspired me.
Yeah. And when I was reading your book, it reminded me of, it's like a spiritual autobiography. And so this spiritual autobiography is beneficial to you, but able to help other people. So who is the target audience for your book that the book could help?
Dr. T, initially we were thinking of writing this book to teenagers, right? Youth. My experience growing up in the inner city in Fort Lauderdale, Florida, and really wanting to have a dream and work towards it. And then after the book was published, I'm getting calls from adults who read the story and were inspired, and the audience began to broaden. So we were fortunate to see many people benefited from the book.
Awesome. The title, Rebuilt. How did you come up with the title? What is the meaning behind Rebuilt?
Well, when you think of like building something or something that needs to be rebuilt, there was some damage or something was destroyed. In my case, my dream came crashing down when Coach told me, like, Trahern, we have to let you go. And within seconds, he said, but you're going to be okay. And initially, when I got that news, I was shattered. But when he said, you're going to be okay, like he knew that I was a man of faith. And I was fortunate at the time to do a lot of spiritual work with my team. And so that was where that key critical rebuilding process came for me, because as I mentioned in the book, one door closed, but another one opened for me to go back and rebuild my life.
I love it. And as I was thinking, this is not one of the questions, but you and I do a lot of work with helping those with retirement from sport. When they're cut from a team, when they have a career-ending injury, or that their tenure in the league has just come to an end. When did you start preparing for your retirement from sport?
That's an excellent question. I think I could have been better prepared because I didn't know at the time that a 4-year contract, it was like year to year. But as I got into the league and I found out, even though I'm drafted in the 5th round, I still have to make the team, right? Because there are a number of players coming in, a number of players that are being released. So I would say the process for me to prepare for retirement, when I understood the reality of the NFL, and some people like to use the acronym, it's not for long, but again, just realizing that it's not going to be forever. So I want to maximize the opportunity. And I learned so many great things while being a part of the NFL that they're still with me today. So I would say for me, entering the league, but when I got there, learning that my time would end prematurely, I had to start, working fast towards my second career.
Excellent. I appreciate you sharing that. And I'm going to talk a little bit about the outline of the book. But as a male and as a Black male, we have to help with owning feelings and emotions, right? And how would you describe your feelings and emotions when Coach came and said, we have to let you go when you were transitioning out of the NFL?
I would say it was painful. I would say devastated. I would use illustration of being shattered, right? So you go through all of these emotions. You're upset. You think of what could you have done differently. So there's like so many emotions that you go through. But definitely, I would say just the painful, being hurt. That was really that feeling that I felt.
You talk a lot about faith in the book. Where did your faith development and process come in your life at that time?
It came in for me when I had to pick up the phone and call my parents, right? And like I gathered myself and I had a fear, right? I had to return home to South Florida. I felt like I possibly let the family down, and I just really wanted to have a long career. But when I called home, I remember my mom. She's gone on now, passed on, but she knew something was wrong when I called, and she said, "You're okay." And then I told both my parents I've been released. I've been fired from my job, and they said, "Son, come home." Right? That was like a breath of fresh air when they said, "Come home." So for me, that's when my faith really hit home, and I got back to my core, right? And that was a very critical time or essential time for me.
Yeah, so now that leads me into the outline of your book, because from that time to now, even though it's been years, the title of each chapter sounds like you're getting back to your core. So first of all, I don't know if people can see, I have your book electronically in hard copy, but here's a copy of the book. Let me share with our audience some of the top titles of the chapters. Believe in yourself, determination, the power of faith, a lesson in humility, opportunity, dream fulfilled, and discovering my purpose. I'm an existentialist, and these are all existential titles and finding meaning in your life. But how did you come up with the title and the outline for your book?
So these are essentially different experiences of my life, right? So the opening title, Believe in Yourself. I speak about having low self-esteem, low confidence growing up, partly because I was husky and just really through sports, I was able to find myself and through mentors. The chapter on determination, it took a lot of determination to continue to push on when you face challenges. So that was the subtitle there. And then the power of faith, right? That's my core, like that's who I am. And interestingly, I talk about how even though my dream was lost, my faith wasn't lost. Right. So that was key. And then humility. Life is filled with so many challenges, so many transitions. And the lesson in humility, for me, I believe God used sports to as a lesson to show me the importance of humility. And I still practice that today. Opportunity, as I mentioned, when one door closes, another opens, and maximizing that opportunity and being prepared for it. And a dream fulfilled, right? One dream is to make it to the NFL. But then after that door was closed, another dream was like resurrected, right? So that was important for me. And I had many other dreams that I achieved. And then discovering my purpose, like living my purpose today. And I feel like all of it led me to living my purpose and finding out like what's that thing that I'm put on the planet to do.
I love it. I love it. There are many great stories and nuggets in the book. I have found a couple of them, like I said, that I have highlighted. But is there a story in the book for you that sticks out the most, or the most memorable, or the most meaningful?
The story that sticks out for me, I would say that moment when I had transitioned out of the NFL. And this was the day when my father, he always preaches on Sunday, right? And at this time, my mom had become ill. And he said to me, well, son, I'm going to be with your mom. And I was afforded the opportunity to share the sermon that morning. And it was the same sermon, my first sermon, the same sermon I had preached about building your life. So that had meaning for me because everything took me back to my foundation. And being on the platform, facilitating her service, Dr. T, I didn't even know how I was going to get through that, right? The youngest of five, baby boy, and just to have the spiritual strength to officiate my mom's service. So that story stands out for me, in the book.
Yeah, that was a powerful story. It's interesting. I'll go back because when we met, we were trying to increase help-seeking behaviors with players. We were trying to dispel stigmas and myths about mental health. So here it is, we're talking about it, but during lunch and dinner and breakfast, we're sitting at a table eating with the chaplains. And here it is, we're bridging the gap between faith and mental health and athletics. Yeah. And when I think about our role, and you're an ordained minister and now a licensed marriage and family therapist, I'm a professional counselor. What led you to choose marriage and family therapy versus psychology, social work, or professional counseling to kind of go alongside with your ministry?
For me, when I was released from the NFL, I would say I had a lot of mentors and supports. And we currently had a licensed marriage and family therapist at our church, attending at the time, facilitating groups. So in the book, I mentioned when I was cut, I was so ashamed to go back to church. I shouldn't have been, right? But I'm like, these are the people who I grew up with them, and what am I going to tell them? But to answer the question, when I returned to service that Sunday, he looked at me and he said, I know a profession that you can use or that you can pursue that will leverage your faith and sports, and it will be able to help you in the ministry. So that essentially led me into marriage and family therapist. And my father, he's a Christian counselor as well. So having those supports led me down this path.
Wow. Interesting to hear you say that you kind of had this fear of going back to church. And there was a player for the Pittsburgh Steelers that I worked with. His fear of going to church was because he was worried that congregants would ask him for money to help with this or help with that. So why is it important for us to talk about mental health in faith-based communities, in churches, and with coaches and athletic administrators?
You mentioned the stigma, right? There's such a stigma with seeking help. And I believe that ministers, pastors, we have a unique responsibility to be able to treat the whole person, right? And in order to treat the whole person, you're going to have to address both the mental health as well as the spiritual. And I think as we have these conversations, it opens up doors to treat the whole person. Because you think of it, statistically, about 35% of athletes, elite athletes, really struggle with mental health diagnoses, burnout, depression. So we want to make sure that we, treat the whole person and have a holistic approach to treating some of these challenges that people face in our congregations.
And I love that. And we can apply scripture. We can talk about the man at the pool of Bethesda. Jesus asked him, do you want to be made whole and well? Right. And when we're talking about being well, that's mind, body, and spirit.
Exactly.
Yeah. So what makes it difficult? You talked about the stigmas, but what makes it difficult to bridge the gap between mental health and faith-based communities?
There are many reasons. As I mentioned, it's interwoven, but then you have the faith and the science, right? And I think that there's just this separatism between both of them. But again, with this psychological and spiritual divide, I think it's just awareness, and then being open to something different. And I say that openness is important because, many may be territorial when it comes to the congregants and trying something different and unique. And I think it's important to have, at least in the church, in the body, just both spiritual, but also having the mental and really being equipped to address challenges.
So how would you recommend we educate, train clergy and ministers and spiritual leaders if there is a role for them in this holistic wellness, this holistic health?
Dr. T, I would say conversations like this. I think it's important, offering trainings, luncheons, different professionals such as yourself, someone who understands both. And when you understand both and how they're interwoven, you can have that conversation. And I think as we, again, continue to equip ourselves and educate ourselves, it'll kind of bridge that gap, if you will, to open the door for more meaningful conversations and see how it makes sense within context, right? And I think that would be like a first step.
We heard about Twitch passing away last week, and it's been reported he died of suicide. And we have to be willing to talk about these things, because if people are suffering in silence, we have to open the doors for people to be able to talk about what's going on in their lives in a safe place, right? Here it is. We're talking about our work with the NFL and professional and elite athletes, your experience. I played all the way up until college, but we could be talking about this with athletes across the lifespan. We now can diagnose children as young as 6. We have right now the NFL and college football coming to an end. Where the soccer, season is coming to an end. Basketball is starting. So what can we do right now to help? We're having these conversations, but as we end 2022 and transition into 2023, how can we make sure that our churches and our faith-based organizations are benefiting congregants and athletes across the lifespan in their churches, and family members that might be suffering with somebody with a mental illness in their family? So what can we do to help these individuals and families?
So you mentioned something that's important. Willingness to create a space for someone to share being vulnerable, right? People don't like to be vulnerable, but it's important. And destigmatizing or normalizing asking for help. Right? I think that's so important, to be able to ask for help and to be able to share. And I mentioned in the book, right, you have this stigma where boys don't cry or like men don't share emotions, but men do go through emotion, right? And creating space where someone is not suffering in silence and being able to open up the ministry where there's an opportunity for these conversations. Something else, where there's mental health professionals who's in the church. I can't overemphasize it enough. Having people with the training in the church is very helpful as well. And pastor mentors, I think it's important, right? Because even as clinicians, we have supervision, right? And we have a place where we can share, and you can talk about your biases and your beliefs, but I think it's important where we can bring all of these together, because we don't want a person to lose their life when there could have been other resources available to them.
Absolutely. So here it is. We're talking about the congregants, families, and benefiting and the athlete population. But let's shift a minute to pastors and clergy. How do we help bridge the gap between faith and mental health with those that are leading the flock?
So that's vital. And growing up as a PK, I've seen firsthand my father help people who have been struggling. But how do we progressively move forward? And I think of the privilege that pastors do have. They see families during times of their birth, and then they see families during that transitional moment of their lives when they have to transition. But they have privileged information. And I think when I think of privilege, I'm thinking how families entrust them to have answers. But do we have all the answers at times? No. So that requires some vulnerability, or requires to really seek help that's beyond what may be spiritual. And that's the challenge, right? When we've gone as far as we can, right? Medical professionals are pretty good about referring out, right? But again, clinically, at least spiritually, being able to say, you know what, this member is really going through a challenge, and maybe I need to refer them to someone to just get a further evaluation. And what does that say about the pastor who does it, right? Does it say he's failed the member? No, I think it really just speaks more of his security or her security in getting the person the help that they need.
Absolutely. So now I'm going to talk about both populations, clergy as well as the athlete population. We know that there is a stigma and bias about help seeking with a mental health counselor with both populations. How do you respond to either one of them? I don't need to go see a therapist or a counselor. I just need to pray more. Or I'm not going to tell my business to somebody.
That's a challenge. And I think we've made more progress in that area, but we still have a ways to go. And when you have a person that says, you know, I'm not willing to tell someone my problems, I like to use the example of how we get help for other things. For example, physically, as an athlete, I used to get help to bring in a trainer, right, to assist in the area that I may be weak, or an area that I need to build up myself. So the language is important, how we language help, right? You can call it support. You can call it mentoring. I think that's vital, how we present someone getting help, because many times a person may not have insight and awareness of what it means to talk to someone. It's not a sign of weakness, it's really a sign of strength. So just continuing to have those conversations is important.
Absolutely. And I'm a true believer. We as clergy, we are human. So who we are outside the church, physical church walls and door, does not stop when we go in. So we really have to be aware and have that self-awareness so it doesn't spill over on our congregants,
Exactly.
right? Same thing with players, is spilling over on their teammates or their family. So how do we help them to increase that self-awareness of what's happening within themselves? What are some signs and symptoms that they might be able to recognize that something is being held internally in their body?
There are many pastors who recognize burnout, right? And they're willing to take a leave. But when you mention the signs and symptoms, that's important. And then what happens outside the four walls of the church is vital. So that means we have to strengthen the family system, right? And with strengthening the family system, empower everyone in the family to be willing and have the courage to tell a loved one that, you may need to seek some help, or even call for help for that person. They'll, at the moment, they may get upset, but they'll appreciate it down the road if you do that.
And I appreciate that. So I was kind of thinking individual counseling, but you talked about strengthening the family. Let's help some of our listening audience. I don't want to assume that they know, but what is family therapy? What is couples counseling? What does that look like? What does that entail? And what are the goals and objectives?
Yeah, so when you think of family, you think of the system and the unit, right? So for example, let's say you have John. Well, John is really struggling in his interpersonal relationships with his family. So therefore, when you bring the family together, you want to identify, well, what's the goals of the family? And then how can we support John, or what may be contributing to some of John's, if he's having outbursts or something like that, because it's so important to look at family drivers and how they may be contributing to a specific problem. And when you think in individual therapy only, yes, we can give John skills individually, how to cope. But then when you place them back in that family system, if you have not addressed some of those triggers and some of those factors that lead to it, then the behavior won't, or the skills won't be sustained that you have helped John with.
I'm so glad you said that, because we can't expect one family member to change and the others don't change. Otherwise, it's just going to revert back to where it is. And when I am working with young people and a caretaker, a mother, father comes in and says, I need you to work with Johnny. Okay, that's fine, but I'm going to be having family sessions, because if we are going to ask Johnny to change, we have to expect the family system to change. Why is that so difficult for families, Dr. LaFavor?
It's difficult, like when you mentioned for families, for couples, because you think the other person is the problem. So if you fix them, things are solved. And many people don't like to look within, right? And look at what may be some things that I'm doing that may be contributing to the problem. So I think, again, it comes to vulnerability, being open, being aware. All of these things are so important for families. And just being able to communicate, that is vital. But it takes work. And I think with the work that's required, sometimes people shy away from it because it does require a lot of work to fix broken, relationships.
Absolutely. So with that, if families go to the church first, because most often people will go to their faith-based organization when they're in a crisis. So if we have a family crisis, how can churches and faith-based organizations help to bridge the gap between faith, mental health, and family systems?
So if a member goes to the church first, right, and pastor, let's say if he has the training, he may be able to confidentially address that. But if he doesn't have the training, then the family is entrusting him with not only spiritually, but also the mental health aspect of it as well. So that pastor would have to be open to reaching out to a referral and really getting the person the help that they need that may be beyond what is spiritual. So for example, let's say if it's depression and a person is really struggling, right? Where they're not getting out of bed and it's really affecting their functioning. And when we think mental health, we think of functioning, right? So when we think of clergy, if something is affecting, Miss Mary's functioning, she's not getting out to church, she's not, you may say, well, it may be more than spiritual, right? So then I think it's important to have a group of referrals, have a trusted mental health group that has a faith-based understanding A lot of seminaries now are offering pastors psychology and different courses. So I think that's important. But again, we're being willing to refer out because they may need medication. They may need an assessment, a biopsychosocial, with something to make sure that they are whole. And I think that's important. And Jesus wanted people to be whole, and that is vital.
Absolutely. Let's shift a little bit. Let's talk about ethics. Both of us are clinicians. Let's help our listening audience understand our ethics as clinicians in terms of confidentiality and privacy.
Yeah, so ethically, as clinicians, we really don't share anything beyond the therapeutic interaction that is outside of someone harming themselves or willing to harm someone else. So other than that, everything is confidential. And that's so important with athletes. They really want to know that in this space, when I share, is it going to go outside of the room? So that is important. In the past, I've heard people talk about they may have shared something in a spiritual space, probably with a pastor or someone like that. And if a pastor is not trained, he may be inclined to share that. And that's so important because that privileged information, you want to make sure that it just doesn't go beyond the room. So that's important, not only for the mental health professional, but also for the clergy.
And that's what I was going to ask next. What are some of those ethical considerations specifically for pastors, ministers, chaplains that they should be aware of that might be similar or different to our roles as clinicians?
So the pastor, he or she, they're entrusted with privileged information, and they have individual factors that may impact a person's response, to situations. So, for example, let's say if a youth in the church is experiencing a challenge with anxiety or depression and willing and open to talk with the pastor, he and his parent, yes, they have the privilege and they're entrusted with that, but then what do you do with that? That's critical. And they have to just be transparent and say, you know what, this is my first experience with this challenge, and I'm going to refer you to someone in the faith community. And the family is trusting that, you know what, with pastor, I know he has my best interest at heart. He's going to get me to someone who can get me the help that I need. So that's important from at least from the clergy and bridging the gap with someone in the community.
I'll talk specifically about the Black church. There is this cultural mistrust, right? And if I am a pastor of a church and I need to have a list of referrals, how do I go about developing a list of people that I can trust to refer my congregants to?
So you can connect with other ministers. Ideally, as I mentioned, that they would have supports that they can reach out to. I can't, a number of times being you have collaborated, but again, having someone that they can reach out to as a part of their cohort who knows someone. And that's the importance of being able to work together, having a multidisciplinary team where you can all work together, and he can reach out to someone or she can reach out to someone and who can lead them if they don't know someone. But again, locally, I would encourage them to possibly reach out to a seminary. Hopefully they would have resources that would be faith-based and other things that they can do in the community where we can kind of bridge that gap and make sure people are getting appropriate referral who understand the faith and can treat both and.
Absolutely. And I appreciate what you said in terms of you and I collaborating, because it's also coming down to personal connections and relationships. And so, when I get pastors or I get athletes in Florida, I have you in South Florida. I have my clinicians in Central Florida and Orlando, and I have mine in Northern. And so I'm always reaching out saying, hey, I have someone. So I think it's important I'm open for pastors connecting to me and saying, hey, do you know somebody in Texas? Or, and I know that you would be willing to give referrals because you've done that as well. And I would say, go to the seminaries, connect with the universities, but also, especially now when we're talking about coming from an anti-racist perspective, that the cultural mistrust, that coming from a trauma-informed, it may come down to that personal connection that you might know.
Absolutely. And some people, they like a cultural match, right? And they want to make sure that the person looks like, me. And that means that we need to definitely have a group of people or professionals that we can reach out to who can establish engagement. For example, with sports, the fact that I have a sports background, that helps me with engagement. And the fact that a person may, have similar backgrounds or similar ethnicities, that'll be a bridge to help at least with the initial engagement as they provide the treatment that's necessary and to overcome some mistrust.
Absolutely. So I'm gonna, before I ask the last question about the tips and suggestions, I want to go back to your book. The last chapter, I was intentional in not giving the title of the last chapter, but the last chapter is what's next. What's next for you as it relates to working with families, the church, the faith-based, your role as a clinician?
So what's next? Interestingly, after I wrote the book, I continue to facilitate youth empowerment. So we currently have that at our local church where we do a youth empowerment. And we talk about different topics such as self-esteem, how to deal with peer pressure, and just really, integrating some topics to help our youth have the tools for life. So I've started doing that. That's been very rewarding. We have some men's empowerment sessions that we're getting ready to launch to help empower men. And then we're going to transition to Rebuilt for Women and Youth. So we're excited about that. And to empower elderly, that's one of my goals. I'm passionate about the elderly. So that's something that is on the horizon as well, where we can find ways to work with the elderly, and I may say bridge the gap as well with the elderly and the youth to really work together. So I'm excited about that.
I love it. And so here it is. We're talking about doing this across the lifespan because we do need to attend to our youth, our adolescents, and our adults, whether it's young adults, middle adults, or the
Absolutely.
So we need to make sure, because there's different concerns for each of those populations.
Yes, absolutely. That's vital. So
Yeah.
I'm looking forward to it.
Yes. Going back real quick to the ethics question, and we have about 12 minutes, so I'm going to check all of the social media platforms. So if anybody has questions, please use the chat box. For those of you on Zoom, if you have any questions, just raise your hand and I'll bring you in. But here it is. Your father is a Christian counselor and the pastor. You're an ordained minister and a licensed marriage and family therapist. I'm now ordained and I'm a clinician. How do we help people to understand our roles in the church context?
Excellent question. In the church context, I think it's unique when you have all of that training. And as far as the church context, it just has to be communicated. And my role as an elder at the church, the members know when I'm functioning in that role on Sunday, that's the spiritual role that I'm in. And then there may be a member who would need support and they'll address it from a professional standpoint. But I differentiate between those roles, right? So I have my private practice in which I obviously will address the mental health, the relational, from a confidentiality standpoint. But then also the ministerial, I differentiate the both. I think it's important. And you have to articulate that in what you do in your practice.
Absolutely. So That's good. So now, what tips and suggestions might you have for pastors, ministers, chaplains, coaches, or congregations for addressing faith and mental health in their churches and ministries, as well as the field of sports?
So I guess the first tip I would say, and you mentioned for pastors, right? So for pastors, can't overemphasize enough. Pastors are privileged and entrusted with information from families, and they're with families in very challenging moments of their lives. And I would say just making sure that they're equipped to address some of those challenges, mental health, emotional, whatever it may be. And if it is something beyond their scope, being willing to reach out for help. Same thing with ministers and chaplains. For coaches have been very vital in my life, and a coach can really encourage a player and build their self-esteem and really be there for them. And again, for coaches to have insight into mental health, that's important as well. A number of NFL coaches have some training in mental health, and that's important because when you see those signs and symptoms with your player, if they're in practice, you see that they're down, or you see that they may not be up to their normal functioning or capacity, you can have that conversation and encourage them on campus or wherever you are to reach out for support. So that's important. And for the mental health professionals, just being able to understand both worlds, right? Yes, you understand the mental health, you have your interventions, but then you have to understand the faith and do some research and how to really bridge both and bring those together. And something that may be helpful is where a mental health counselor, we've had that at our church, they do a presentation at your church and really have these type of conversations. And that destigmatizes, at least in our community, about mental health.
Absolutely. I like that. And that's another strategy and a tool is find out who are mental health providers in your church and have a workshop or training or presentation and talk about it from the pulpit.
Yes.
Yeah. Now, I mentioned earlier on suicide, but we also need to talk about suicide more in the church. I have a question from one of our viewers. In the case of suicide, what do you say to others in the family who live with someone who attempted but failed?
So if someone attempted but failed, I would definitely encourage that family to get some help, right? Because it is vital when someone attempts, that means that there's a cry for help, right? They're really going through a challenging moment. So I wouldn't stop there. I would also just encourage that person to get a mental health evaluation where they can get the support and help that they need.
Absolutely. And we also need to be open to talking about suicide. We cannot shy away from it. Suicide is an equal opportunity, suicide attempts are an equal opportunity experience. It does not discriminate by religion, gender, race. And so we have to talk about it. And so I'll just kind of put this plug in right now for anyone who's on now or watching the recording later on. If somebody is in crisis, we have the new phone line 988. It is the suicide and crisis lifeline. All you have to do is dial 988. We can all work together to prevent suicide. Dr. LaFavor, what else would you like to share that we have not talked about?
We covered so much, Dr. T, and again, it's been a privilege being on your show, and this conversation is vital, and I hope that our listeners will continue to be not only inspired, but take from what we talked about and take it back to their churches or their communities where it can provide some additional support and help. But overall, it's been a pleasure to be with you and your audience.
It's been wonderful to have you on. So let's help the listeners learn more about how they can get your book. How can they go about getting your book, Rebuilt: Life Before and After the NFL? And do you have any social media platforms you would like to share?
Yes, so the book is available on Amazon. I have it available in audio. It's also available in paperback, and you have the electronic version as well. I do have a Facebook page, and we're going to be sharing some upcoming events that we have in Twitter and different things of that sort. So that's going to be some things that we're going to be sharing with upcoming events.
Oh, this has been wonderful. I thank you for sending me information about your book a few months ago, and I've been wanting to get you on the show. So I thank you for taking the time to be on the show. And I also don't look at this as ending for us, and that there might be some other ways for us to collaborate in the future as in our work with faith, mental health, and working with the athlete population.
Well, thank you so much, Dr. T. Again, it was a privilege being on your show.
Absolutely. Thank you, everyone, for joining Talking with Dr. T. I appreciate you all joining from LinkedIn, from YouTube, and from Facebook Live. I will be monitoring the chat. So if you are watching the recording and have questions for me or for Dr. LaFavor, I'll make sure that he gets those questions. And please be on the lookout for advertisement for Talking with Dr. T in 2023. Our next show will be the third week of January. I hope everyone has a happy holidays, Merry Christmas, Happy New Year, and thank you all once again for joining us. God bless.